back and we're on the air. Next guest, who you know well, Ellen O'Brien of HealthWyse. Welcome, Ellen.
Thank you. Good to be here.
And you know, you were so eager to start telling us about the business, but now the mic's on, you can do it.
Well, HealthWyse was founded in 1998 by two entrepreneurs, two engineers who had been at Hewlett-Packard in their medical division. And the company emerged at a time when home health had some new mandates for documentation. And in response to that, it was an industry or a niche of an industry that was really on paper. And in response to the new regulatory environment, they decided to really develop a complete, fully integrated electronic medical record. So HealthWyse currently serves about 50,000 users across the country in 46 states. We do electronic medical record systems for home health, hospice, and private duty agencies. So really the post-acute. And that sector in healthcare is really emerging with the Affordable Care Act and a shift towards lower cost, community-based delivery. We find that our segment of the marketplace is really taking precedence as people are trying to prevent hospitalizations and trying to really stay engaged managing chronic care comorbidities, you know, in older populations struggling with more health issues over a longer period of time. You know, that's not really something you deal with acute care hospitalization and physician office visits. So it's a marketplace that I think is growing in importance, and I think the work that's done by these agencies is really pretty incredible because it's very complex. And in order to support very complex care delivery and increasingly highly regulated care delivery, having a good support system to document all of that is very important. So,
what are some of the major changes you've seen in that industry over the last few years?
Well, if you look at hospice, for example, you know, in the last 10 years, there's been probably an 8-fold increase in the number of people using hospice benefits. With any opportunity that comes along like that, you're always going to attract people that are looking to make a buck and people that are looking to be fraudulent. So the government has said it's great that people are using hospice because it's oftentimes a more appropriate, humane choice than having people end up in an ICU for the last 2 weeks of their life. You know, most people would say I prefer to die at home being surrounded by family. In order to manage that care, they put in and prevent fraud, you know, they've put a lot of things in place. The hospice item set, for example, trying to say we want you to document how you're delivering care. We want certifications that in fact the person is terminal. We want to track very closely what kind of care delivery you're giving them, and we want to make sure that the team is coordinating care. So in order to do all of that, you know, these are clinicians. They're not people that are computer savvy generally. They're not people who want to make it their living to fill out paperwork. They really want to be helping people. And so the more easily you can facilitate care delivery through a really intuitive electronic system, it's a win for everybody.
So you make it possible for these home health care workers to be compliant with all the documentation, all the systems, so they have smooth operations.
Exactly.
And that's a big field for elder care.
Oh, absolutely. So if you
That's the growing field.
Yeah. So if people are getting out of the hospital, for example, and they have a hip replacement, you know, it's increasingly the norm that they go home rather than going to a rehab hospital for 2 weeks. So they go back to their home, but you know, they may need a lot of supportive services, not just physical therapy, but they may need wound dressing changes, they may need medication checks, they may be on new meds, pain meds, you know, having somebody evaluate their home for fall risks. A whole spate of things that people don't
It's complicated.
Yeah, people don't think about it unless you've had the experience yourself with a relative, or if you've had orthopedic surgery, you know, you realize when you get home, wow, once you have some impediments, you need help.
Alan, if someone wants to find you and talk to you at HealthWyse, how would they do that?
So if it's eobrien@healthwyse.com. If you go to the website and fill out the contact form, I see all of those, so you're certainly able to do that. And the phone number is 877-777-9973.